Welcome to another episode of Progress, Potential, and Possibilities, discussions with fascinating people designing a better tomorrow for all of us. I'm your host, Ira Pastor.
Welcome, everybody, again to another episode of the show, bringing you another fascinating guest today who's helping to create a better tomorrow for many people. Today we are going to be continuing, as I say, on our around the world virtual road trip. We are headed over today to the DRC, the Democratic Republic of Congo, and have the opportunity to meet with Dr. Dumazedier Kabasele, who is founder of the Dumazedier Kabasele Foundation, a nonprofit organization in DRC with a goal to raise awareness, prevent, treat, and ultimately beat stroke back in the country. Dr. Kabasele earned his medical degree from International Christian University in the DRC, completed special training fellowship in neurology and electroneurophysiology from the National Institute of Mental Health and Neuroscience. In India, he studied and trained especially in stroke care from the Hospital du Cinquantenaire in Kinshasa, and recently joined a program at Brigham Young University here in Idaho to complete a degree in applied health and public health. He's pretty busy. He is very passionate about all areas of vascular neurology, paralytic stroke care, and he has appeared recently in numerous TV shows and talks, ultimately to raise awareness about various neurological disorders in the DRC, and strongly believes in transforming the world by giving people hope and helping them have a better life and health. And we're honored to have him with us today. Dr. Kabasele, thank you so much for taking the time to come on the show today.
Thank you so much. Thank you so much to invite me on this show. I'm very happy to be your guest today.
It's really good to have you. We've been chatting over the years, and I'm glad we had the chance to do this. I'd really like to start off like we typically do by giving you the microphone for a little bit, just to talk a little bit more about you. You have a fascinating background. Take us back a little bit to the beginning, if you would. Where did you grow up? How did you first get interested in science and medicine, and a little bit of your journey into neurology? I think that'd be a great way to start things off.
I grew up in Democratic Republic of Congo here in Kinshasa. It's a wonderful country, and where I grew up, I was interested in medicine because all my life I was sick. When I was a little child, and all my parents were saying to me that each day we was in hospital. On the 1 week, that means 6 days in hospital. Only 1 day I was just living at my home, and it was too much frustrating for my family and for my father. And my father was saying to me, they had a lot of good doctors blessing your life. They were supporting you. Then I grew up in this idea. Then I say, okay, myself also, as most people bless my life, why should I not bless life of others? That's when I joined medicine. And I started my first degree I got in my Congo. Then after I joined India, I went to India for a special training of a fellowship in neurology and electrophysiology. That means we are doing EEG, about NCV, EMG, testing of muscle, testing of nerves, even to know about the brain, about EEG. Then after, when I finished this, then I say, okay, being interested in public health again. And then I joined again Brigham Young University to do about public health that I joined. Then also now I'm coming back here in Congo to help my people. Then being interested of building an NGO, I've built an NGO to support about stroke and beat stroke here in Africa. Because here in Africa, if you're having stroke, that sometimes no one treats correctly, Sometimes people doesn't know exactly what is stroke. Sometimes also no rehabilitation is there. Then I say, okay, let me work on stroke and see how we can bless life of others.
And speaking of stroke, if we go to the World Health Organization website and look at the leading causes of death in the world, it's there, stark in our faces, second leading cause in the world. Estimate around 15 million people around the world suffer a stroke every year. About 5 million die, 5 million left permanently disabled. Talk a little bit about the current situation in DRC, if you would, sort of a little bit of the stroke figures as you study them there, and Africa in general, because I'm sure that, I know that, you probably see patients from not just the DRC, but from surrounding countries as well. Talk a little bit about stroke as it pertains to both DRC and Africa, if you would.
More of the statistic of stroke, it is the first cause of disability here in Africa. This is our first cause of disability, and most of people are having disability due of stroke. If you are going for a sick patient or around statistic, we have a lot of people developing stroke because we don't know exactly what is the cause of stroke. And most of people, they are having hypertension, not going to hospital, not taking the medicine. Most of our patients having diabetic, they're not taking medicine. For them, they're just thinking that the whole thing will be healed by himself. Some of our African people think that God will hack directly. And you can imagine, not only in Congo, all Africa, we have the higher rate of statistic of people developing stroke. Before it was only Europe, but it was only around America. But now the day here in Africa, because no one exactly giving an awareness about stroke, and people doesn't come in hospital. And people that are coming in hospital, they're coming too much late. And you can see each day we are receiving in all hospitals receiving case of stroke, and we have a higher rate of stroke now in Africa. Because why? Because not prevention are going on hypertension or diabetes or cholesterol. Even we have now a lot of stress. Not only that, even lifestyle. In Africa here, we're not eating good or not healthy. And seeing if you can compare Europe, you can compare another country. Our lifestyle, it is very, very complicated and too much down. And this is the most common cause of stroke in our area.
And it's interesting because this leads into your foundation, and clearly you have outlined in some of the materials that you've shared with me a very broad program here. So you're not just focusing on raising the awareness, as you were just talking about some of these preventative measures that one could be taking, but there's a whole continuum here, how you treat the stroke patient to save a life, how you reduce the disability, and then ultimately, if there are disabilities, how we prepare for life after stroke. I know you juggle a lot of responsibilities in the DRC. You also, you're still an attending physician as well as running the foundation. Talk a little bit about when you developed the foundation, a little bit of what you're looking to achieve with it, and how you sort of interface the whole program that you outline in there with some of the existing healthcare system, the hospitals, and so forth that you work with in DRC.
Our goal, it was to help people to understand first what is the stroke. This is our goal of my foundation. What is stroke? And the second thing, how to treat stroke and how to prevent it. What I've found here in my community, it is that you can see some people doesn't know exactly what is stroke. When they develop stroke today, then they can take it around 1 week, 2 weeks, 3 weeks, even 1 month after they will come to you to hospital. When you ask them a question, what time you develop stroke? They're saying you 1 week back, 1 month back. Why did you not come to hospital? I didn't know. Some people are giving you, oh, you don't have money. Some, thinking that it will move away. The goal of my foundation was not only to prevent, to treat, and to beat stroke in our country. And our goal it is to work not only with patients, to work also with medical staff, because nowadays also we have the new guideline of stroke, and most of people doesn't know exactly what is the new guideline of stroke and how to treat stroke. And the third thing for us, our main project is each stroke patient, they should go out from the hospital with a plan. What is the treatment plan? What is the rehabilitation plan? Most of us, after you developing a stroke, then after they treat you, then they put you out. You don't know exactly what is the plan, what we will do, how they can help you about recovering. But our NGO now, we are working just to support not only patient, supporting the medical staff and supporting also the family. Imagine that I am the husband of my family, then I'm developing a stroke. How can I got money? How can I go to work? You see how my family will be too much stressful. But we should have people that can support also family and to help them how to link with the patient that will help recovering faster. This is our main project of our stroke. We are working full on DRC to prevent, breed, and treat stroke in our country.
I noticed, you work at, additionally, I mentioned the Cinquantenaire Hospital in Kinshasa, which I believe is the first or the second largest hospital in the country. Is part of sort of defined as the medical city. I was just wondering, what's the current state of sort of either investment in or foreign investment in sort of the advanced healthcare infrastructure currently in DRC? I mean, it is, we think of DRC, at least here I'm sitting in the East Coast of the United States, and I think of it as very rich in natural resources and energy and things of this nature. What's the current state in 2022 of sort of just the healthcare investment infrastructure, whether it's within DRC or foreign companies that are setting up the biomedical infrastructure in DRC?
10 years back, my country was very down with infrastructure of medical things. But now we have now a lot of people coming to invest. Now we have, as I told you, we have a good center among here in Kinshasa. And investment is very easy. And you can see we have MRI, we have a CT brain, we have a ICU team, we have a stroke specialist team. Not only in my hospital, now most of people are coming to invest in Congo, and it is a very safe place because they are coming, and it is also a good thing to be paid. Here, most of people are coming to invest. They are receiving a lot of money because they are building their name, they are building whatever they want, and you can see. And is my hospital that I'm working, Hospital de Cinquantenaire here, you can see it is the largest, it's the first one full DRC. It is investment from Indian people. They come and they invest in our country. Not only Indian people, we have even some American people coming to invest there. I don't want just to name the hospital. Even Canadian people, they are coming here to invest. Then you can see we have a higher standard hospital nowadays and on all my country. Not only in Kinshasa, even in all province, because most of them, they understand that if you have a good hospital here, you will do a lot of money. Before, a lot of people was going abroad. They was going India, they were going Europe, they was going America to get treated. Now, if all facilities are available here, they're not going again there. All money for plane, all money for hotel, all money they are spending there, they are using it here.
Excellent. You, in addition to the foundation, and obviously in addition to your work in neurology, I know that you've had to take on additional roles in the last couple of years. You've had to serve as a project manager for the COVID-19 response in DRC. You've been doing a lot of work in public health in general, in other areas. Talk a little bit about what the last couple of years have been like for you as you've also taken on these additional responsibilities.
It was my first time in my life to work on this critical, very complicated situation. I tell you, when the COVID-19 starting in my country, imagine most of my people, most in Africa, people was not accepting that COVID is there. They say, oh, COVID is only for Europe people or American people, not in Africa. In Africa, we don't have COVID. But when we're starting having a lot of cases, now it was very difficult for us to manage. Then I was assigned, because I have a degree in public health, and I was assigned to be a COVID-19 manager on my area. Then we set a goal that to reduce the case in our area. And we was putting people in quarantine. Not only in quarantine, our government helped too much also to treat free. All patients was treating free, even in ICU, mental care, all treatment was free for them. And this experience helped us too much that to recover and to take most of people. Because some people were starting having a COVID, they was afraid. They said, if we go hospital, we don't have enough money to be treated. And as the government took it, was free. And we having a good success in Congo. It was before, it was very difficult because it was a new disease, was unable to treat. But what is our treatment? In Congo, we was using a simple, we were using a chloroquine tablet, was using azithromycin. Then we was using also dexamethasone, and we are giving vitamin C, zinc, even paracetamol. This was our treatment we was using here. And this treatment was working, and we save a lot of life with this treatment.
What it's interesting, because I was watching one of your presentations, I think it was from Brigham Young, and you were talking about sort of other things that you're going to be getting into in the coming years. And there was an interesting part of your presentation where you talk about the development of new healthy interventions based on environmental and ecological change. And this is very interesting because we've talked a lot on the show about, although we think of health as health, there's all these changes that are happening and they impact health, whether it's the infectious diseases or whether it's climate change, whatever it may be. And I found this very interesting that you're thinking forward in this context. Talk a little bit about what some of the new areas looking out in 2022, 2023. What are some of the other plans you have in developing this broad public health, model, let's say, that you're interested in creating there?
I'm always giving an example. The way it was operating someone who was having a disease 20 years back, it is not the same we should do operation now, because the procedures are changing and innovation are coming. But now most of people are just focused on the past. But now you can imagine we have ecological change, even environment change now in our days. But we should also adapt our situation to this area. What is our plan? Our plan now, it is to connect ecological with a new innovation of each type of disease. This is our new plan. Let me tell you, let's see simple about COVID, as we were saying about COVID. Before COVID happened also, but it was not treating it with chloroquine. But you see how people are finding a new treatment due of this surround. And even how, for us, we want to developing a new model of public health that will be based not only on treatment, but to be based also in environment, even in culture change of each step of our area. And here you can understand, here in Congo, you can see in Africa, especially, we have a different path, and we should also develop our model based on each developed part, depending on the climate, depending also of the area, depending also of each culture of the people. I cannot just develop, because I cannot just take the model of developing in USA, just apply it here in my country. No, this is very different, because you should know exactly what is the culture, what is the area, what is the climate, what is the environment building. This is what we are working now. We want to develop each project based of the area, based of the ecological system of specific domain.
Outstanding. One other thing I wanted to mention, when I before the show, when you had sent me your biography, I found it very interesting that you don't introduce yourself as a doctor or a neurologist first in your bio. The first thing you mention is that you are the husband of Shudel Kabasele, who is your wife. She's a nurse. And I always, we always talk about influencers, important people in one's life on this show that have been there with them. It seems like, from what I've seen in the literature, you and your wife make a very important healthcare team there. It's not just one of you, but working together. Talk a little bit about your wife, if you would, and the importance of her in this, in the Dr. Kabasele equation, but also in this integrated vision of public health that you have in DRC.
As you say, most of my introduction, even you can see most of my show, I never introduce myself as a doctor because I've already let people understand. I already believe that you should let people trusting you, not only saying that I have degree, have this degree, have this degree. No, based on what you are talking, people can understand that this have a background or not. My wife, she's a nurse, and her name is DR Kabasele. Also, she's a wonderful lady. That is why I mostly want to introduce myself as I'm husband and a father because I love my family too much. And together we are establishing a good healthcare project for our Congo because we want a new innovation. We want to help people. We want to support people. And this is what our desire, my wife have also. She's a wonderful. She grew up also here in Kinshasa, in Congo. And we met also when we was in medical field. We was working previously in another hospital when we met. And she was working too much good. And she was loving too much of a patient. Now, you know what? Let me give you some story.
Please.
Most of my patients were saying to me, "This wife, she's wonderful. She know how to take care of neurological patient. And if she know how to take care of neurological patient, she can take care of you." Because I know that you can
marry her.
Because neurological patients are too much complicated. Sometimes they have paralysis, they have some disease, and if someone are able to control them, that means all the life she's able to do whatever is possible.
That's wonderful. While I have you, any other programs? We talked about stroke. We've talked about your public health interests, your wonderful relationship with your wife. Anything else for 2022, 2023 that you want to mention that I have not touched on? Please have the floor.
The only thing, we already discussed whatever, but the only thing that I want just to talk to everyone around the world that we can bless the life of others and we can support people. Whatever we are, we can just continue to do our impact there. And we believe that if we have a good innovation and you're developing your approach based on environment, based on ecological model, you can be a good team manager and you can having a good success. In my new career of public health and neurology, even as a physician, I understand that working with colleagues, working with people, we can just establish a good model of health. And half nowadays need people that they should go do a good impact around the world. That we need. We need people that can have innovation. We need people that they are developing a new model. We need people that they are creating and giving hope to people. And we need people also continue to work hard and to support people.
Outstanding. Yeah, and I love your message of innovation, but also crafting innovation for specific local environments. It's not all one model, as you say. The U.S. model may be good, but it's, the DRC requires other models, and you have to craft them. And I think it's great what you're doing on all these fronts. I'm going to continue to follow you and stay in touch, obviously. For everybody that is going to be listening on the podcast networks to this episode or watching on the YouTube channel, again, you've been listening to Dr. Dumazedier Kabasele, founder of the Dumazedier Kabasele Foundation, doing really amazing things on the front of stroke, public health, environmental and ecological thinking in medicine. Dr. Kabasele, I want to thank you again for taking the time out of your schedule to come talk for a little while on these themes. Obviously, thank you for everything you're doing there and creating these new models. And as we say on this show, Thanks for helping to create a better tomorrow through what you're doing. Really great story. It was really good seeing you.
Thank you so much for your time also. I'm very happy that to share this, that we can creating a new model and bless life of others, whatever we are.
Absolutely.